Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm your host, Ashley Meservey. It's Medical Monday at East Cooper Medical Center, and today it's time to calm those fears as we learn all about the ways you can ease your mind before your next doctor's appointment.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, Dr. David Geier. He's becoming a regular here on Living Local. Thanks for having us.
Oh, thanks for having me.
All right, so today we're talking about why people don't go to the doctor.
It's so common. I was just telling somebody the other day in clinic, at least once a day somebody will come to my office, knee hurts, shoulder hurts, and you ask them how long it's been, and it's been a year or 2 years, and you think, well, why didn't you go get it checked out? And people seem to think, well, I'll give it a week, I'll give it a few weeks, which is great. And then they realize after a certain point, it's not getting better. And so I think it's really important at some point, if you're not able to do what you want to do, go get it checked out.
Talk about the fact that people really just need to trust their body too a lot of times. I mean, I know we have hypochondriacs out there who just believe that they get injured just walking across the street, but sometimes it can actually, they're literally making it much worse, right?
Absolutely. I mean, sometimes, that pain is actually a sign of a real injury. And I get it. You don't want to stop your sport. You don't want to stop your exercise. And you're afraid that, go to an orthopedic surgeon or a sports medicine doctor, we're going to shut you down. But if anything, we want to get you back to it. We just want you to do it safely. So knowing what it is can go a long way into helping us get you there.
Okay, talk about some of the older folks at home who don't really realize how much medicine's evolved though too. I mean, you have more options now than you ever have, right?
Absolutely. I mean, if you look at even the old football players from the 60s and 70s, and they're now in their 50s, and you see these foot-long incisions on the front of their knee, it's just not like that anymore. We do ACL reconstructions and put in new meniscus and all sorts of these big surgeries through 2 or 3 little poke holes that you basically are big enough to get a pen through. You can do major reconstructions just through a few little holes. Doesn't mean it's easy. There's still a lot of recovery and rehab, but it's night and day different than the way it was 20, 30 years ago. Talk
about the recovery though. A lot of people have fears after they get a surgery. I know I did after I had my back surgery that you're going to get hurt again or that you're weaker.
Absolutely.
What are some of the ways that you can kind of ease their mind about that?
It's so common. It's great that you brought that up because we see that even in the high school and college, even in the pro athletes, they don't know how their body's going to respond when they try to exercise, when they try to play their sport. So I think that's where something like this, getting into physical therapy, working on some of those movements that you do in your sport and your exercise to test it out and get more confident on it. But they can help get your strength back and your motion back, things that are really hard to do on your own. So I think it's a lot of hard work, but having something like physical therapy to get you a little bit further, very, very important.
And you mentioned confidence. I always believe that if you believing you're going to get hurt, you're going to get hurt. Talk about really that added, experience you have with your patients and why it's important that they regain that type of confidence.
Yeah, it's so important. And the trick is, it's hard sometimes to instill confidence. Sometimes you can kind of see it in the follow-up visits. They seem really apprehensive when you start talking about the timeline of return to play. But if you can identify that fairly early on, there are ways to rehab people and put them through the motions they have to do. So if it's soccer, you can replicate going up for a header, in physical therapy. You can replicate landing on uneven surfaces, but you really have to identify it. And it's really important on the patient to say, I'm really worried about this. What can I do to get better?
So communication is key.
Absolutely.
All right, doctor, thank you so much for having us again today. And as always, you can visit them online at eastcoopermedctr.com.